Hello and welcome to the video presentation of Just Breathe. How do we breathe? The process of breathing begins with the nasal cavity, which passes through the pharynx and the larynx and into the trachea. As the trachea branches out into left and right bronchus, each branching enters into the right and the left lungs. These bronchi branch out into smaller bronchioles, which end up in the alveoli. These alveoli are wrapped in capillaries which carry oxygen and bring carbon dioxide to the alveoli. Hence, as this was explained in the video using the balloon model. The oxygen we inhale gets into our cells by way of hemoglobin. The process of inhalation and exhalation. As we breathe in, oxygen enters into the lungs and diffuses into the blood. It is taken to the heart and pumped into the cells. At the same time, the carbon dioxide, which is our waste product, goes into the cells of the body and diffuses into the blood and then diffuses from the blood into the lungs and is expelled as we breathe out. When a person inhales, muscles attached to the ribs and the breastbone contract and lift the ribs and the breastbone outward. During inspiration, the diaphragm contracts and pulls downward, while the muscles between the ribs contract and pull inward. This increases the size of the thoracic cavity and decreases the pressure inside. As a result, air rushes in, fills the lungs, and when a person exhales, the rib and the chest muscles as well as the diaphragm relax. The ribs fall back into place and the diaphragm bulges upward into the chest cavity. External respiration is the exchange of gases that take place in the lungs, and internal respiration is the exchange of gases in the cells. So why do some people have larger or smaller lung capacity than others? Not all lung capacity is equal. For example, among males and females, males have a larger lung volume than females. The male stature and mass are larger, and therefore their thoracic volume follows, creating a greater lung capacity. Taller people also observed to have a larger capacity. This does not, however, influence breath quality. Stature does not influence improved lung capacity. However, athletes as a whole do have better lung capacity due to their enlarged lungs from the efficiency of their gas exchange. People living at a high altitude are subject to oxygen that has a lower partial pressure, which means that they have developed lungs that allow for a larger volume in order to have more efficient gas exchange. Smaller lung capacity, for example, is due to smoking. Smokers can have damage to the alveoli and the bronchial tree, and thus they will have a smaller lung capacity. So describe how asthma affects the lungs. Well, asthma affects the lungs by causing the muscle tissue around the bronchi to spasm and constrict. This essentially prevents air from getting into the lungs. Asthma triggers an inflammatory process that causes limited airflow due to bronchoconstriction, hyperresponsiveness, or edema. It triggers inflammatory cells, including mast cells and macrophages and a whole bunch of other cells that are linked to IgE antibodies, releasing inflammatory mediators such as leukotrienes, histamine, cytokine, and prostaglandins, and nitric oxide, which have effects on the blood vessels, the smooth muscles, nerve cells, and goblet cells. So describe the medications, priorities, and nursing management for a patient with an asthma exacerbation. Medications include those that reduce inflammation and dilate the airways primarily. These include short and long-term beta agonists and corticosteroids along with antihistamines. The priority is to maintain airway patency. Evaluation of oxygen saturation must be continually monitored and kept above at least 93% per hospital protocols. Provide adequate rest and nutrition, as many asthmatics are at risk for malnutrition due to persistent cough, malaise, and anorexia. Exacerbations require immediate or first-line treatment, such as an controlled inhaler known as albuterol. Medications include corticosteroids such as flucagonide, prednisone to reduce the inflammation, and bronchodilators such as montelukast, which are intended for more chronic conditions of asthma. Long-acting beta agonists for chronic asthma include salmeterol, as well as metaxalones such as theophylline. Lastly, anticholinergics, including ipratropium and expectorants such as guaifenesin, will help control mucus secretions. Nursing management includes removing the stimulus, or the trigger for the asthma attacks, and educating the patient and their family about household supplies that may elicit an attack, such as detergents, cleaning solutions, and changing out home filters as needed to reduce mold and improve and maintain the air quality. So, what would be important to teach the patient with asthma? Well, teach the patient with asthma on how to use their inhaler properly. Teach the patient to avoid outdoor triggers and take the inhaler with them if they plan to be outside near trees, grass, or pollen. Teach them to avoid high pollution areas such as cities when possible, and to wear a mask around construction sites or areas of reported air pollution quality that's above 50. Direct patients to visit sites such as one government-run site known as Air Now to check the air quality in their designated area of current residency, and teach patients to avoid high altitudes, cold, and high humidity climates. Teach the patient to get a house inspection for mites and cockroaches and to clean air filters periodically. Avoidance of strong odors, pets, and especially smoking should be cautioned against. Teach the patient about paying attention to signs and symptoms of an asthma attack, such as wheezes, throat closing in on them type of feeling, shortness of breath, anxiety, chest tightness, or cough. What community resources are available to clients with asthma? There are a variety of resources for those with asthma available. The CDC offers information on environmental health topics, including asthma, indoor and outdoor pollution, and mold. Another site that allows for lifestyle adjustments for effective control is the EPA. Their site is known as the EnviroFlash, provides daily air quality information such as forecasts and action day notifications via email for the area of one's interest. And I hope this helps, and this concludes our presentation. So I hope as a result, everyone breathes better after listening. Thanks.